Hello and welcome to hashtag our Doc Talk. This is our chat with the community, and with us is NorthBay Healthcare Chief Medical Officer Seth Kaufman.
Thanks, Robin. Good morning, everybody. I hope you had a very nice 4th of July. I'm Dr. Seth Kaufman. I'm the Chief Medical Officer here at NorthBay Healthcare. I'm also an emergency medicine physician. We took a little break last week, and we're back today to update you on where we are with COVID in our community and answer your questions. I hope you had a really nice 4th of July. I did. My kids and I sat in the pool and just tried to enjoy the quarantine July 4th this year. Of course, we missed having fireworks and all the other ways we can come together for 4th of July, but it was a nice time. Since our last Facebook Live session 2 weeks ago, things have changed dramatically. I'm going to talk to you a little about the numbers this morning, spend a few minutes updating you on where our case rates are and our hospitalizations, and then we're going to go right into your questions. So let's talk about Solano County numbers. As of yesterday at 4:30, the last time our epidemiologists and other public health colleagues updated the Solano County dashboard, we had 1,922 confirmed cases and 40 hospitalizations. Those numbers are very high, and I say that because it's a fairly large jump. If you look at other counties, you'll see higher numbers, but you need to consider it. You need to consider where the size of our county and where we've come from. So what our numbers looked like before. The state has a new database which we will post on the our Facebook page, where they're modeling different counties. Solano County is currently at number 9 out of the 58 counties in California in terms of our R effective, and I want to define that. Our R effective for the last 7 days is 1.29. That variable means that for every person that is infected, their potential for spread, so it's a potential for spread variable, is that it's for every one person, at 1.29 for every one person, they are going to infect a third of one person and a third. So as a better example, if you had 3 people in Solano County that got infected, they're now going out and infecting 4 others. So you can imagine exponentially how that accelerates the spread, Some other numbers for you. On June 17th, so just a few weeks ago, our hospitalization rate was at 10, and right now we're at 40, a 400% increase, correct? A 400% increase. So a 300% increase. Sorry, there. A dramatic increase in our hospitalizations, and it's not just about people needing hospitalizations. It's also about the acuity. So how sick are people? A few weeks ago at NorthBay Healthcare, maybe we had 10% of our patients requiring an intensive care unit. Today, that's about half, and it's been consistent that way for the last week or so. That half of our patients require an intensive care unit. This is not just about NorthBay. This is absolutely across the state, and obviously in other hot areas, hot zones. We're seeing that also. With that, let's talk about more about where these cases are coming from and what you can do to avoid getting COVID-19. The cases, when we look at the demographics of these cases and the profile of these cases, we are seeing much higher cases in younger people. That's been consistent and it's just getting bigger. So about 11% of our new cases are in the over 65 group, years of age group. But in terms of our hospitalizations, and they represent something like 80%. So it goes back to things we already know. In general, we're seeing more spread in younger adult, middle age. But of course, when our older population gets infected, they're a much higher risk for getting sick and for dying. So all very concerning. And what is the source? The contact tracings and investigations that our county does, that NorthBay does, that other systems do, are showing that the vast majority remain families and social gatherings, usually indoors, and absolutely continues to support, the trigger continues to be non-compliance with the current recommendations: mask wearing, hand hygiene, and social distancing. There are some workplace outbreaks. It happens. Again, it goes back to is everybody doing good hand hygiene, mask wearing, and social distancing? When you look at healthcare environments, and the highest risk being nursing homes, assisted living, we are seeing actually really optimistic and positive results. So these areas are being monitored very closely, and at currently right now, we really have no significant outbreaks in any of our nursing homes or assisted living facilities. It shows you what effective monitoring and screening, and from visitor restrictions to mandates on mask wearing, which we have in the state now, but also healthcare facilities have been doing we've been doing here at NorthBay and other facilities, very strict mask wearing policies for quite some time. It shows you what those the impact of those interventions. So that's the good news for today. It is kind of the only good news for today, but we're not seeing a lot in our healthcare environments. With that, a reminder that that NorthBay is a safe place to go for care. We have a lot of rules and a lot of compliance. We have a very dedicated staff, and many are watching this right now and would agree that we have a very committed and dedicated group of staff. Everyone wears masks. We do our best with physical distancing. Hand hygiene, of course, is practiced 100% of the time. We do cohort, so we place in the same areas our COVID patients. We do our best to absolutely separate out anyone that we are concerned about COVID, are separated into different areas in the ER, in other environments, and again, we cohort both in our intensive care unit and on the floor. So people who require hospitalization, those require ER care, you should feel safe coming in, know that you'll be wearing a mask, that you'll be evaluated and placed into a safe area. We have really high-level cleaning protocols that include UV light cleaners, and we are open and ready to help you. We do not want, one of the biggest concerns, and it continues to be a concern, is with those who really need care. We don't want you to delay coming in and get sick and get sicker. This is going to be our challenges with COVID. This pandemic is not ending anytime soon, and we need to make sure that we're providing health care to our community. That is my update for today, and with that, I'm going to turn it over to Robin, who has some questions from you for me.
We have a number of questions coming in that have to do with the numbers. And first off, they want to know how many of those positive tests are not symptomatic. I don't know if you have hard numbers, but generally, can you speak to that? And also, how many are actual COVID patients versus they come in for some other medical situation?
Okay, so the question is what are we seeing in regards to asymptomatic people having positive tests, and or people coming in for other reasons and turning and having positive tests? Super good question. So first and foremost, there's not enough testing right now to really test those who have no symptoms. There's WHO is talking about this. Other symptoms are talking about this. For every patient that's positive, there's likely about 5 to 10 out there that have not been tested who have COVID. Some might be mildly symptomatic and just kind of home and dealing with it. Think about early in the pandemic when we didn't have any testing, and we were telling people, if you have a cough, just stay at home and isolate. And some are asymptomatic, a good number. So that somewhere out there, there's a bunch of studies showing. There's one showing for every 2 infections, there's 12 that have gone undiagnosed. So we know there's a lot out there. What are we seeing at NorthBay? We're not really testing those with no symptoms at all. So very few. We are testing, all our admissions to the hospital are tested, and we have had a few, not a lot, we've had a few who have tested positive but are being admitted for something else. So just a few. So overall low, I don't have an exact percentage for you, it changes every day. Overall low, or someone, for instance, maybe is being admitted to the hospital for a hip fracture, but their test is positive. The other group would be our pre-procedure testing. Again, with a goal of keeping our staff safe and all our community safe, we're testing all our patients who are going through some sort of procedure or surgery. And in there, out of over 1,000 tests, we've had a few, maybe a little more, somewhere like a handful of patients being positive who otherwise had no symptoms. This group that we're testing, we're first asking them, do you have a cough or fever? If they say yes, we're delaying their surgery. If they say no, then we're testing them. We've had a handful. So those are pretty low numbers. But I would say it's because we're not testing the entire county. If we did, those numbers would be higher.
So why does the info on COVID change from day to day? Seems like you get different information on different things each day.
Can you ask that question one more time?
Why does info on...
Info. Why is the information about COVID changing every day? That's a very general question. It's a really good question. I think if we were sitting together, I would say, tell me what kind of information, because there's certain things that are absolutely known and have been the same since the beginning, and there's absolutely things that are changing every day. So let's talk about what is changing every day. Every day there's a study coming out that changes things a little bit, from new treatments to a treatment that we thought was beneficial but not. Hydrochloroquine is a great example. First maybe shows benefit, then maybe shows harm. Now there's a recent study from Henry Ford saying maybe shows benefit. So I think every day our news agencies are doing their best to report out the new information that's going out. During normal times, there'd probably be more data before we would be reporting out to our communities. But with this pandemic, one study gets published and it goes out to everybody. So the answer is, one thing is studies are really coming out on a daily basis. It also shows you the robust amount of research going into this pandemic on a daily basis, from vaccines to treatments. The numbers are changing dramatically. As I quoted at the beginning of this, we've gone up. We've had an astronomical increase in case rates and hospitalizations. And so I do think every week at least does feel very different. Just a few weeks ago, we had very low census in our hospital. There was moderate numbers of cases in our urgent care and our ER, and now the demand is through the roof, and our positivity rate is through the roof. It's really spreading quickly, and that is true. It's just changing every few days. It's not that it's being hidden for a few weeks and then being sent out. You're learning almost at the same time I'm learning how this pandemic is changing.
So one of our viewers is asking this, and thank you for the questions that are being posted. We want you to keep posting them, and we'll try to pass it along to Dr. Kaufman. They're asking, if someone gets COVID, can they get it again?
No one knows that. That's a really good question. We do know that there are some limited studies in the last month or so showing that one kind of antibody, so that's your body, that's the factor that fights infections, and we develop those antibodies after getting exposed to the vaccine or the actual infection, does drop and goes back to zero after a certain amount of time. That doesn't mean a vaccine won't work, and it doesn't mean you're not immune. That's only one kind of antibody. So the answer is we 100% don't know that yet. I'm not aware of any cases where someone tested positive and then tested negative for an amount of time that made us believe they really didn't have it, and then tested positive again and we believed it. I don't think anyone knows that yet. The pandemic's not old enough to really know that completely.
Someone is pointing out that there's a doctor in Texas successfully using a nebulizer treatment on COVID patients. And does NorthBay do anything with breathing steroid treatments?
Not at this stage. We are evidence-based in our recommendations, and and everything has adverse effects. Nebulized steroids are actually very, very safe, and I look forward to seeing that study. We are using steroids for treatment, but that's following the data that came out from the study a few weeks ago, which showed benefit in patients who were on oxygen or even more ill. So those requiring some level of oxygen, which means they're usually being admitted to the hospital. We don't send patients home with oxygen and say, don't worry, you'll be okay. So usually, unless they're already on oxygen, usually patients get admitted when they're on oxygen, and the decadrons, the dexamethasone, the steroid study showed benefit in that group, and those really in the critical care realm. It did not show benefit for those not requiring oxygen. But to answer your question directly, we are not doing nebulized steroid therapy today.
Okay. I've heard there's been a lot of success with proning patients. Is that something that people are recovering at home should do? And how does it work? How do you need to stay in a prone position?
Sure. So So the question is does proning work, and should we be doing it at home? Proning does work. It is literally laying on your stomach so you can mobilize other parts of your lung, and has been shown to be beneficial in many lung illnesses, not just COVID. We do it religiously on patients who are ill, and there's no data that I know on home proning. I'll tell you that my thought on what to do, if you're thinking about proning at home, the first thing to think about is, am I exercising? So am I really using my lungs and expanding my lungs to help, essentially filter out everything bad and use and get air in there and air out? So my advice would be, are you walking, if you're sick, are you walking around the block, very careful, well, you should, with a mask on, or more, maybe it's safer to say, are you doing things in your house to try to mobilize your lungs and take deep breaths? In the hospital, we call that incentive spirometry. So really trying to open up your lungs to help heal. That's what I would recommend for home, is to try to do the things that really get your lungs open. And proning does work, and it's commonly used in the hospital. We do it on everybody with severe disease.
My husband works in a high-risk exposure job. How concerned should I be that he might bring COVID home with him, and how likely is it that I might contract it and bring it to my place of work?
Oh my gosh, that's a great question. So the question is you have a family member that works in a high-risk exposure environment. What's the chances, or should you be concerned that he or she will bring COVID home, and then what are the chances that he or she will transmit COVID to you? The answer is yes, for all of it you should be concerned, and the goal is, what you should be doing is putting in safety measures to avoid this. If he works in a high-risk environment, is that environment doing everything they can to keep him or her safe? Mask wearing, physical distancing as much as possible, and hand hygiene. Then when that person comes home from work, do you have a transition area in the garage? Is there a bathroom off the garage with a shower? Whatever it might mean, it really kind of depends on what they do for a living and how much exposure there is. Is there a transition area where that person can change clothes, and those exposed clothes are kept in a separate area, put directly into the washing machine, whatever it might be? Do your best to create a kind of a zone that nobody else goes in, where that person could change clothes. That's your best bet. If this person contracts COVID and you're not, and he or she is not isolating as a precaution, your risk for getting COVID is very high, because we know that COVID transmits easily in indoor environments and with close contact if no masks are being worn. So So that's what we're seeing. We're seeing social gatherings. We're seeing entire families that are turning positive. Not everybody gets sick. Most do not get sick, as you know, but there's a percentage that do. So do everything you can. Put in safety measures. That's what I do at home, right? So I'm, those staff members at NorthBay Healthcare and others in the healthcare environment are in a high-risk exposure environment. And the key is to have that transition area at home be really compliant with these prevention measures.
Can you explain the difference between the antibody test and the COVID test?
The question is can you tell us the difference between the antibody test and the COVID test, which I think that when they say COVID test, they are talking about the diagnostic, pretty uncomfortable swab testing that all systems are doing right now in state and county. Yes, I can. So antibody testing has not really been useful as a diagnostic test. It's a blood test, and it gives you some picture of whether there's been past exposure. Some of them are better than others. Many of them, the commercial tests, are not that useful. In other words, the results don't help you at all. When it's a high quality test and it's negative, both for the two kinds of the commonly tested antibodies, IgG and IgM, it probably tells you you have not been exposed at all. If you are positive for IgG, that's the longer term antibody. It either tells you that you had COVID at some point in the last few weeks or longer, and it's thought to turn positive maybe at 17 or 18 days after exposure. So that's why I say a few weeks earlier or longer. Or you were exposed to a different coronavirus, a different COVID virus. Coronaviruses are very common. It's a common cause of it's common cause of the common cold. So that doesn't 100% mean you had COVID. It could mean that you had a cold and didn't even know it, or maybe you did have a cold and that was not coronavirus. If you are positive for IgM, which is the other commonly tested antibody, that one pops up earlier, so a handful of days from exposure, and you should get a swab test after that to see if you're positive. However, know that IgM test is even less specific, which means it doesn't really tell you for sure it was a coronavirus. Again, the test could be wrong, or it could be that you have some other remnants of a different coronavirus in your bloodstream, and that's also not uncommon. That's what makes the antibody test very difficult. The swab test is much more easily interpreted, and if you have an IgM, which means maybe you had some recent exposure, you would expect most of the time, not always, for the swab test to also be positive if it's reliable. There's reasons why it may not be, but overall, the swab test is testing for active or pieces of RNA from that virus in your mouth, where this infection generally begins and it goes down your lungs. It starts in your nose or your mouth, right? So both surfaces are possible, and they generally all mixing. And you should have, if it's a good swab and it's positive, it means you really had coronavirus. Some of the rapid tests, including Abbott, have not been shown to be very sensitive, which means a negative test doesn't mean you have coronavirus. It could mean that the test is wrong. A positive test, for most, are reliable, and the tests that you're having that take a few days or longer to come back are very reliable, or as reliable as we can hope. Most are if they're positive, that means you really have coronavirus and are likely pretty contagious. So it's a very good test. The swab test is a good test, and the best test we have right now, the PCR swab tests, are the best tests we have right now to say you have coronavirus or recently did and are possibly infectious. The antibody test is a very mixed bag and may tell you were exposed. It may not. It may tell you it may be a different coronavirus. And just know the only other caveat is the rapid tests, depending on which one you have, some are better than others.
This person's heard that there's a swab of the mouth test or a drive-through self-test in the Bay Area somewhere. Have you heard about that, and is it true? And do you know if it's reliable?
The question is, they've heard of a mouth swab test and also some self-testing. Yeah, both are available. There are some areas that are doing, I don't have the list on me right now, that there's 100% self-test options where you get a kit and usually it's with an observer. So it's a way, so at these testing sites, they would hand you a kit in your car, you would roll up the window and you would swab yourself and then hand it back to them. I don't have more details than that in terms of locations. Number one. Number two, there is some data that self-swabbing with an observer is as good as, with instruction, is as good as somebody doing it for you. And I wait to see more data on that. I think it's encouraging. My only caveat, and this is my own personal opinion, is these swabs in your nose, and then we'll talk about the mouth, are very uncomfortable. So if you're doing it at home by yourself, my thought is that it's just not going to be as good as somebody else doing it to you. And the specimen swab, the specimen on that swab it's the most important factor in getting a reliable test result. If you don't get enough mucus on there or a good swab of your nose with stuff on there, it's going to be negative, but you're not going to really know. You need a really good specimen, and it's got to be pretty far up there if you're doing a nasopharyngeal swab. But I will say that there's more recent data showing different parts of your nose are okay, and an observed self-swab is okay. The same goes with the mouth. Many tests out there allow for nose and or mouth. So there are some protocols out there saying you can do the back of the throat. You could do the back of the throat or the nose or both with two different swabs. There's a lot of different protocols out there. But it's the same test. It's just you can get a specimen from the mouth instead of the nose.
This person wants to know if there's a blood test instead of a swab. We all wish.
Yeah, so some of the question is there a blood test instead of the swab? Not for a diagnostic PCR test, for the molecular PCR test that I'm aware of. You can hear me talking a little more slowly. There's so many tests out there right now. Is there a blood diagnostic test? I don't think so. I'll tell you, it's a good reminder. I'll tell you that this is not a blood-borne illness. That may surprise some of you. For those of you in the healthcare field, you might be like, well, of course, it gets, the ones who are very, very sick must have it in their bloodstream. But this is primarily a lung disease. It stays in your lung, and those who get really sick just get horrible, horrible lung disease, and they might get sick with other infections also. But if you test their blood, it's not necessarily going to their bloodstream. So I'm not aware of a diagnostic, like non-antibody, that's similar to the swab. I'm not aware of that test.
We're getting close to the end time, but we have a couple of questions.
Okay, I'm going to try to be brief. Here
All
we
right,
go.
This one, I think they mean ibuprofen, but they write ibuprofen.
Yep.
Is that a different drug?
No, not that I'm aware of. So ibuprofen,
okay. They want to know, is it contradicted? Can one take it and not be COVID positive but exposed at work? Can you run your, and also they want to know, can you run your AC at home? In other words, is that if somebody's in isolation in your home, can you run your AC, or is that going to spread the virus?
Okay, so a few different questions. Let's see. So close. Let's see. Let's start with the ibuprofen. That was very early data that ibuprofen potentially had a problem. That's all gone now. You can use ibuprofen. Most people who have there's still most people who are sick with some sort of virus are not going to be COVID. You should feel free to use ibuprofen or Tylenol. If you have COVID, there are some recommendations to start with Tylenol because why not? They're really both fever medications. There's no data showing one's better than the other, but the data early on for ibuprofen has not been reinforced. So that's number one. That's ibuprofen, which is also Advil and Motrin. Those are all the same medication. They're all ibuprofen. and it's a very effective fever reducer. So again, you should not be fearful of using ibuprofen. If you have a confirmed case of COVID, you may consider starting with Tylenol, but you should feel okay if it's not working to take a little ibuprofen. Talk to your doctor about it. You might get different opinions. But overall, the data early on ibuprofen has not been reinforced with any bigger studies that show it's harmful. The air conditioning question is tough because it depends on how your air conditioning is working and where the air is coming from. Many are just recirculating air and cooling it down. Some are coming in from the outside. It just kind of depends on what the situation is. I will tell you that, yes, if you have air circulating inside your house, it is going to be pushing around the virus. Indoors, close contact is the biggest risk factor for getting this disease. So if you are worried about COVID and therefore you don't want to run your air conditioner and it's 100,000 degrees outside right now, I would tell you, it's not healthy to sit in a house that's 100 degrees. You're going to get sick from that also. So I would tell you, the person who has it should be isolated, and that's in their room. Mask wearing should be used around the house, and that's a way to avoid getting it.
Okay, and one last question they're asking: is it possible to transmit COVID through open waterways, like while you're kayaking or floating and enjoying the
low
swimming?
risk? That's a low risk environment. So that's, if I'm understanding the question correctly, asking about waterways, like you're on a river, you're on a lake. Those are outdoor environments, and the risk is low. The risk is low. So I would say it's a low risk environment.
That's all of our questions, but
sounds good. Thanks for joining us today. We'll be taking next week off. We'll be back here at 10 a.m. on July 23rd to answer your questions and update you on what's happening here in Solano County. Thank you so much.
Thank you.